Striae. This is one of the things that can happen if you use topical steroids that are too high of potency for too long. Striae is kind of another word for stretch marks, okay? We're talking about the types of steroids, not the ones that you take by mouth, but the ones that you put on your skin for different conditions like eczema. But there can be negative side effects. One of them is this striae or stretch marks. If you use topical steroids for too long and of too high of a dose, it can cause these changes in your skin. Another thing that can happen is atrophy, meaning that your skin actually can get thin in the areas that you are putting the topical steroid, wherever that is, if you use too high of a dose for too long. An example of a topical steroid, this is one that I have in my medicine cabinet. Many of us have topical steroids in our medicine cabinet, whether you got it over the counter from your drugstore, whether your doctor prescribed it. I actually think it's a good idea to have a topical steroid on hand. However, you must know that topical steroids, topical meaning you put it on your skin, not taking it by mouth, they have different potency levels, meaning some steroids are much higher and higher of a dose and stronger than other steroids. Generally, steroids that you buy over the counter have a lower potency level. Oftentimes, the prescription ones we get can be very high potency depending. And the longer that you use a high potency topical steroid, and the longer you use that, the more likely these changes can happen to your skin. Let me tell you about some more changes before I tell you about what to do about this and how to make sure this doesn't happen to you. By the way, I'm Dr. Jen. It's good to see you. The next thing that can happen is telangiectasia. It's kind of a mouthful. Telangiectasia. Gosh, I get this word wrong. I mean, it's hard to say. Telangiectasia. This is basically a word for small dilated blood vessels. Where you are using that topical steroid, it can cause this dilation of blood vessels called telangiectasia. I got it right. There we go. So this is another possible side effect of using steroids for too long and too high of a dose. A few things you need to know about steroids. I told you that there are different potency levels. You should also know that different parts of the body are riskier when it comes to topical steroids. For example, the face, the eyes, the genitals, those areas are very, very sensitive. And steroids can be topical ones can be particularly damaging to those areas because the skin is thin, okay? So keep that in mind. So yes, it depends on the steroid that you have and the potency, but also how long you use it, and of course the place that you put it on your body, because places like the face, eyes, etc., the genitals are going to be more susceptible. Let me also tell you, you can get like an acneiform eruption. What is that? Like acne, okay? You actually get like acne, what looks like acne, as a result of using topical steroids for too long. That is not what we want. Now, before I tell you the last thing that can happen the last thing I'm going to discuss in this video that can happen from topical steroids, keep in mind, I know you're wondering, well, then how am I supposed to know how to take my topical steroid? This is where your doctor comes into play. And I'm not sidelining and not answering the question for you. What I mean is that it's different for every steroid and for every condition that your doctor might be treating. If they have prescribed you a steroid, make sure that you follow the directions on the instructions that they give you, because that is how they want you to take it. Generally, when I write a prescription for a topical steroid, I will tell people don't use longer than so many days, etc. Make sure you follow that advice. If there is not specific instructions on your steroid, you need to call your doctor. Or if you're using a topical steroid over the counter for something, you need to ask your doctor, hey, I've been using this cream for this thing. How long can I use it for? Because let me tell you, if you use too much of a steroid for too long, you can get any of these conditions. And I have seen some cases where it's not reversible. Now, many times once you stop the steroid, okay, it will go back. Your skin will revert, so long as it's not been too much time. I have seen cases where people have used too high potency of steroids for too long, and their skin does not revert back to normal. So please understand this. The last thing I want to discuss is sort of topical steroid sort of withdrawal symptoms that you can get. If you do take a high enough potency for too long, you can get redness, you can get itching, pain, and burning in the skin, okay? So remember, steroids are really, really awesome medications. They fix a lot: eczema, rashes, dermatitis, all sorts of stuff, right? But they have to be used in the right way, and you can have major problems if you don't use them in the right way. Let me know if this was helpful. Share this video with others. Subscribe to my channel. I'm Dr. Jen Caudle. Please follow me on Facebook. I'm on Instagram, TikTok, LinkedIn, WhatsApp, etc. Please follow all my stuff, and then sign up for my free health newsletter at drjencaudle.com. Bye.